Hi, my name is Kristen Souza, a licensed mental health counselor specializing in ADHD. And today I'm going to talk about ADHD medication, both stimulants and non-stimulants. Treatment for ADHD will often include the use of medications along with therapy. Current ADHD medicine available includes stimulants, non-stimulants, and antidepressants. Today, stimulants are the most widely prescribed medication for ADHD. However, some people do not respond well to stimulant medication and do not tolerate the side effects well. Some people may need to explore other options like a non-stimulant or antidepressant. So what do ADHD medications do? These medications can help reduce hyperactivity and impulsive behaviors while improving attention. The way these medications affect the body depends on the type of medication that you're prescribed. For example, stimulant medications such as adderall or Ritalin influence neurotransmitters in the brain that play a role in focusing and attention span. Stimulants are effective, but also have serious health implications and side effects. So it's important to discuss with your prescriber side effects and benefits. Non-stimulant ADHD drugs like Strattera, which don't pose the same risk, are also available, but might not drastically change people's ability to function and focus that stimulants do. Some of the most common ADHD medications available include methylphenidate or Ritalin or Concerta, amphetamines like Adderall or Vyvanse, atomoxetine like Strattera, clonidine like Catapres or Catve, and guanfacine like Intuniv or Tenix. ADHD medications for adults versus children. Medication can be a part of treatment for adults with ADHD and children. The significant difference between ADHD medication for adults and children is the dosage. Also important to note that ADHD symptoms might change throughout adolescence, might change for people as they age, as their brain chemistry changes. So for example, hyperactivity may decrease in children as they approach adolescence. However, at the same time, difficulty paying attention might become more prevalent. The type and dosage of ADHD medication for children may need to be adjusted over time so that the person can continue to manage these symptoms as they change. Let's go over the types of ADHD medication. There are many types of ADHD medications available. Stimulants are the most frequently prescribed medications for ADHD in children, teens, and in adults. So let's go over stimulants first. Stimulants used for ADHD increase dopamine and norepinephrine in the brain, which are both involved in your body's attention regulation. Many different stimulant medications are available and grouped into 3 different categories: short, intermediate, and long-acting. These categories differ in how quickly the medicines work to take effect in the body and for how long they should provide symptom relief. A prescriber will help you consider the benefits of each of them. Let's go over the short-acting stimulant medications. This ADHD medication is released immediately into the bloodstream and is also called instant release. Their effects typically begin within 30 to 45 minutes and should last a few hours. Some of the most commonly prescribed short-term brand name stimulants include Ritalin, Adderall, Focalin, Dexedrine, and Methylene. Now, the intermediate or long-lasting stimulant medications. Intermediate and long-lasting medications for ADHD are slowly released into the bloodstream over time rather than all at once. These long-lasting LA stimulants can also go by other names, including extended release, ER or XR, and sustained release, SR. Most commonly prescribed intermediate and long-term brand name stimulants include, I'll just go over a few of them: Ritalin LA, Ritalin SR, Concerta, Adderall XR, Vyvanse, and Focalin. There's a couple more as well. Now let's go over non-stimulants. This is also a great option for someone that doesn't do well with stimulants. Non-stimulants for ADHD are used as a serotonin norepinephrine reuptake inhibitor, an SNRI. This will improve behavior by increasing their levels in the brain. By preventing the brain from reabsorbing norepinephrine, which is associated with controlling your fight or flight instincts, the neurotransmitter is available longer, increasing one's ability to maintain attention. Though stimulants are the most commonly prescribed medication for ADHD, non-stimulants are also a viable option. These medications may be helpful for people who do not benefit from or do not like the side effects of stimulant medications for ADHD. Some of the most commonly prescribed brand name non-stimulants include Strattera, Intuniv, and Catve. Now let's go over antidepressants for ADHD. Certain antidepressants are sometimes a good fit. Certain antidepressants are also sometimes prescribed off-label for ADHD. These medications are not technically FDA approved to treat ADHD. However, studies show that they help reduce symptoms associated with ADHD. Some providers may prescribe these medications with stimulants or non-stimulants to manage symptoms more effectively. Or providers might prescribe these independently for people who cannot tolerate side effects from other ADHD medications, or maybe they don't respond to stimulants or have a dual diagnosis of ADHD and depression. Some of the most commonly prescribed brand name antidepressants include bupropion, imipramine, desipramine, and modafinil. ADHD medication side effects for both children and adults. Mild side effects while taking ADHD medications are pretty common. Stimulants often cause changes in appetite. In contrast, non-stimulant medications can cause drowsiness, blood pressure and heart rate dropping, and fainting. Prescribers can also manage side effects by changing the dose or the drug altogether. So it's really important to keep in contact with your prescriber and let them know all of your symptoms that you're experiencing. ADHD medication for children. ADHD medication for children may also cause a delay in growth in height initially, but this tends to resolve within 2 years. So this is something to consider when you have your children on stimulant medication. There's a mixed opinion on whether or not stimulants can cause tics in children as well. Children with a personal or family history of tics are usually not treated with a stimulant medication. If a child does develop tics while on a stimulant medication for ADHD, then a prescriber should switch the medication to a non-stimulant medication. General side effects from stimulants include decreased appetite, weight loss, difficulty sleeping, headaches, stomach pain, and delayed growth. General side effects for non-stimulants include decreased heart rate, decreased blood pressure, dizziness, drowsiness, fainting, irritability, dry mouth, constipation, and low energy. So again, it's really important to discuss all of these side effects with your provider. So how do you determine which ADHD medications are right for you? There are many different ADHD medications available that I just went over. What works for one person may not work for you. When finding the proper medication, your doctor will gather information about your ADHD symptoms and what medications you've taken in the past. Some people respond well to stimulants, while others cannot tolerate the side effects or cannot get relief for their symptoms. Here are a few questions you can ask your provider before you start taking ADHD medications. 1. Which ADHD medications are suitable for my symptoms? 2. How much and how often should I be taking these medications? 3. What kind of side effects are common with this medication? 4. What should I do if I experience side effects? 5. Are there medications or substances I should avoid while taking this medication? And 5. What should I do if I want to stop taking this medication? If you have ADHD, you should talk to your doctor about your symptoms and whether or not medications might be a right fit for you. If you or a loved one are struggling with ADHD, you don't have to do it alone. Talking to a therapist that specializes in ADHD can help you understand your symptoms better. We've linked some valuable resources in the description and comments to help you find a therapist, psychiatrist, and other useful resources. Check them out.